soon as our podiatrist joins us, just to let you know that we are starting diabetes testing from the Silver Star headquarters every Wednesday between 1 and 5. So if you want a quick test like the ones you used to have at the Merlin Vaz Centre, then I suggest you pop along and see Rajiv at the Silver Star headquarters, and you will be able to have a test every week given to you for free. So that will come very shortly. Apart from that, good news about the visit of the mobile diabetes unit to Billericay in Essex. If you live in Essex, you can have a testing in the Waitrose car park on Billericay High Street. So you will have the opportunity of doing that then. In the meantime, we will speak to you. I've lost you. Where are you? There we are. In the meantime, I will keep you informed of all developments. So please join us. Our guest today, I think, has just joined us. Is that right?
Not yet.
Not yet. So in the meantime, I'm going to ask Rajiv to just take us through the first of the news headlines of the week, and then we will go on to the other two headlines very shortly. Rajiv, could you give us the news headlines for the week before we are joined by our guest speaker?
Yes, sir. The first news is turmeric has similar anti-diabetic effects to metformin, health experts say. Turmeric has been hailed as a powerhouse spice thanks to its formidable. One second. Mr. Jogia is 1 second. Let me admit him. Due to its formidable anti-inflammatory capabilities and the presence of curcumin. It's an active component. Curcumin has anti-diabetic properties and effects similar to metformin.
Okay, we will stop there with one headline because our guest has joined us. So the message is you need to have some turmeric to help you. Good evening, Dhruv Jogia. Are you with us?
I am live and
Excellent.
present, sir. How are you?
Excellent. Very well. Lovely to see you after such a long time. Thank you so
Likewise,
much.
it's been a while. Pleasure.
Thank you so much for joining us. Members of Silver Star, those who joined us to participate, those who are watching us on the live stream, we are delighted to welcome. I think I can describe him as our favorite podiatrist because we always turn to him when we want to talk about our feet. He's been with us throughout our entire. He's been down Asfordby Street with us at the Merlin Vaz Centre. He has protected our feet with his life, and we're delighted that he's joined us today. He's a specialist in sports medicine with a rich background in managing sports and musculoskeletal injuries. He got a BSc in podiatric medicine in London and holds a postgraduate qualification from the William Harvey Research Institute at Queen Mary University. He's a fellow of the Royal College of Physicians and Surgeons in Glasgow and has prominent roles in the NHS, contributing to education nationwide, and currently serves as an education officer on the executive board of the Podiatric Sports Medicine SAG, the Royal College of Podiatry. He is also a recognised advocate for the profession, having represented podiatry in Parliament and in the national media. And passionate about education and healthcare innovation, he continues to drive these international and national initiatives. So we're delighted to have him. He's very busy. He's rushed in to see us. Dhruv, the floor is yours for about 15 minutes, and then we have some questions. I have a very good question for you to start off with, but the floor is yours. Thank you for joining us.
Thank you, Keith. It's always a pleasure to speak for you, and thank you for inviting me. So I'm here to speak about the diabetic foot, but before I do that, I just got the last 10 seconds of curcumin. I too drink curcumin first thing in the morning. It's anti-inflammatory and really good for your gut, so definitely do that. So The diabetic foot, in brief, if you're diabetic, you should be having your feet checked once a year by a clinician. Now, it used to be podiatrists mainly, but because there's such a demand and there's such few podiatrists available, a lot of nurses and other clinicians have also been upskilled. So through your GP practice or the diabetic foot team, one way or another, you should be having a diabetic foot assessment. Now, the assessment comprises of a number of components. One is a vascular assessment. So they feel your pulses using their fingers, and they'll be looking at the pulses on the inside of your ankle, tibialis posterior, and dorsalis pedis on top of your ankle, your foot. And then they'll also listen to those pulses using a Doppler machine. So the pulse is converted into an audio sound. And when we listen to that audio sound, we can actually tell you what quality of circulation you have. If it's monophasic, biphasic, or triphasic. Triphasic is usually the best. It tells you how elastic your blood vessels are, as they should be. Monophasic suggests it's not so good, but there is blood flow. Not present means we need to do something urgently. Okay. Other than this, there's something called ABPIs, ankle brachial index pressure. So what they do is they look at the blood pressure of the blood flow at the ankle and your arm, do a really big calculation and tell you how good your circulation is. Okay. And they could even do a toe pressure, not just the ankle. They can do an individual toe pressure as well. And why is it that they do a toe pressure? Why do we need to do so much circulation checks for diabetic patients? Well, your heart is here, your main body is here, it's close to your brain, your vital organs are here. Your hands and your feet are the furthest away from your body, which means they're in the peripheries. And what we're checking for is peripheral arterial disease or peripheral vascular disease, because the blood vessels closer to your main part of your body are large, so you get a rich blood supply. The ones that go all the way to your toes and to the tips of your fingers become very narrow and very small and very thread-like. So the circulation really needs to reach everywhere. If you don't get the circulation, those tissues really suffer and they eventually start to break down and die. So the next thing you should be having checked is your sensations and your nerves, because diabetes doesn't just affect your circulation, it affects your nerves as well. So you do a neurovascular assessment. So during the neuro assessment, they check with a plastic whisker. Some of you may have had like a pinprick check in different areas of your foot with your eyes closed to see whether you can feel then a clinician touching you with that whisker. And that whisker is a very clever little instrument. It puts precisely 10 grams of pressure, and that's exactly what you need to feel protective sensation. Now we're talking about protection here. If you can't feel that, there's a fat chance you're not going to feel any sharp objects within your shoes, or if you're stepping on things on bare feet, or you might hurt yourself without knowing. Because one thing diabetes, when it's uncontrolled and to a severe level, it can cause a complication called neuropathy. So you can lose the sensation of in your feet, so you can't really feel if you've hurt yourself, or it can actually exacerbate feeling and make things hypersensitive as well. So you can get tingling, pins and needles, burning, sharp shooting pains, these sort of things. So neuropathy doesn't always mean loss of sensation, it's change of sensation, which is the main misconception people have. But mainly loss of sensation is the one we're looking for. So the protective sensation is really important. Sometimes they might use a piano tuner, which they'll ping and then they'll put onto various areas on the tip of your toe, on the side of your first big toe joint, your first metatarsal phalangeal joint, and even your ankle joint, to see if you can feel the vibration. The vibration, if you've got loss of vibration, that's usually a predictor of neuropathy as well. Nowadays, they do maybe one or two extra things because technology has moved across so wonderfully. And sometimes you can also use a nerve sensation, a vibrating machine, for those people who are difficult. So that's the other thing they will do. So you got your vascular, they'll check your circulation, they'll check your sensations, then they'll check any deformities. So deformities like hammer toes. So you might have a foot, but they have hammer toes or claw toes or lesser toe deformities. And what that does is that increases the risk of pressure in your feet. You might have bunions. You might have heard some of these things in the past. And what these conditions do is they can, because of the deformity, they can cause extra pressure on the joints, such as the ball of the foot and the tops of the toes or the tips of the toes. Okay. And this could be from rubbing from footwear, from socks, and various other methods. Generally, poor fitting footwear, which we'll get onto next. If your footwear isn't protecting your foot or isn't the right shape or size, if you've got deformities, that rubbing can lead to little blisters, and blisters can lead to ulcerations as well. So these are some of the things that we do look for. The other thing we keep an eye out for is your HbA1c, which is the average over a couple of months, what your glucose levels would be. Ideally you want to be around the 5 mark. And your doctor will advise you on exercise, diet, and taking your medication. So you'll have medical cover and medical treatment that way as well. Diabetes is managed through lifestyle as well as medication, and incorporating healthy living, healthy diet, drinking lots of water, making sure that you are active, you are doing exercise, some cardiovascular exercise, keeping your muscles strong, keeping your joints mobile. These all count to a better quality of life and reduction in having diabetic complications. Let's look at some of the complications now. We look at circulation and look for any nerve damage. So if your circulation is poor, then that can lead to poor healing, because we need enough blood to heal. If you've got an ulceration, you would hope that you've got enough blood flow for the skin and the soft tissue to grow back and heal up nice and nicely. Suppose if you've cut yourself with something sharp, it can take time for it to heal up and scab over. But in diabetes, if your blood glucose is not in control and your circulation is poor, this can take a lot longer. Now, that in itself has a lot of complications. You can have things like infection. You can have infection of the bone, because the infection can track to the bone and then can spread and can lead to things like having antibiotics, having IV antibiotics. And if it's very severe and it's uncontrolled, in rare cases, what they really don't want to do is to even consider amputation sometimes. Okay, so that's circulation. Now, if your circulation is poor and you're just not getting the blood flow, that can lead also to gangrene as well, necrosis, tissue death. So it can go black and sometimes toes fall off. And I've seen in clinic where they've just taken their socks off and the toes come off as well. It's really bad circulation, and they wouldn't even know that they're going through so much, because the nerve damage from neuropathy relieves them of the pain. It's a blessing and a curse. Now, if you can't feel, suppose if you've got diabetes, you've got neuropathy, you've got circulation issues, what can also happen is if you can't feel the sensations and you're stepping on things like Lego or any sharp glass and you're walking barefoot and you've injured yourself, you might not even recognize that you've injured yourself. So that's one of the risks of neuropathy, that you need to look with your eyes rather than feeling pain. Okay. So if your circulation is bad and you can't feel you've injured yourself, you've increased the risk of having a wound or an ulcer. Yeah. And the diabetic complication increases further. Now, what else happens when your circulation is poor? What is circulation? Circulation is the level of blood flow. What is in blood? Blood has all the nutrients and healing components. So it decreases your immunity as well. So you're at higher risk of infection. Okay. So you can very quickly see bad circulation, a reduced immunity, and having neuropathy can get quite tricky for people with really poor controlled diabetes. Okay. And it can increase their categorization of with the assessment. What we do at the end is categorize them either at low risk, medium risk, high risk, or are they active patient? Do they have active ulcer or a Charcot-neuroarthropathy? So what can we do? Make sure that you get your feet checked by a podiatrist if possible. However, your GP can organize a diabetic foot check. So that's really important. So if you're not diabetic and you've got relatives, let them know just in case they don't know, because a lot of people just simply don't have the information. I remember, Keith, you organized at Merlin Vaz Center. We had about 100 people in the room, and they were all diabetic patients, and I simply asked, has anyone had their diabetic foot check in the last year? And some of them put their hands up. I asked, how many of you actually know that you need to have a diabetic foot check every year? And less than half of them actually raised their hands. So there's a lot of lack of information. I think that's increased these days, and with the initiatives of what, wonderful people like Keith has really dive deep into the world of diabetes and raising awareness for this. So he's done. I can't thank him enough for this. He works tirelessly across the world and in UK and Leicester to doing this, and he's a huge advocate. And he's done this in Parliament, and he's done this through his charity Silver Star as well. So I can't thank him enough. So they will also do a footwear assessment to see if your footwear is appropriate for you. Okay, so check your footwear, make sure you put your hand in your footwear and make sure your grandchild hasn't put in your golf ball or a piece of Lego or something sharp inside there. Making sure you're wearing up-to-date footwear. If they're absolutely tattered and they're old, a lot of footwear is now binded with glue and adhesives, but some of them still have nails and sharp objects to bind the sole to the top of the footwear. And they come loose, and I've seen many people take their foot out of their shoe, take their sock off, and there's blood all over them, and they just don't know. So check your footwear. Just like you do an MOT and service of your car, check your footwear every 3 months, every 6 months, at least every year, okay? Or get someone else to check it. So these are some of the things we can do. If you can't check your feet, get someone else to check it. And that's really important. Just because the national guideline is you having a diabetic foot check once a year doesn't mean you leave it for once a year. You can do it more often. You can do it every 6 months, and you can do that privately. Go and see a chiropodist or a podiatrist who is state registered, HCPC registered. They'll be more than happy to do an assessment for you. And you know what? It doesn't even take long. It takes 10 minutes to do. And they'll be more than happy to relay that information back to your GP and explain what they've done. Okay, so that's some information. I'll take a break there and see if there's any questions.
Thank you so much. Thank you so much, Dhruv, for that wonderful explanation and all the work that you do to publicize the importance of the diabetic foot. I want to start with a couple of questions, if I may, and then others who are on the program will want to speak as well, I'm sure.
Sure.
One has come through while you've been speaking. The first is, the person has huge difficulty finding a podiatrist in Leicester. Why is it? Why does it take so long? Why are there so few podiatrists who can help us with this problem?
I ought to apologize. So I used to have a private home visit service in Leicestershire. And I live in Hertfordshire and on the border of Hertfordshire and London. So I was covering Hertfordshire and some patients in London as well. I no longer cover Leicestershire, unfortunately, and I get so many calls every week asking if I can come and see podiatrists, and some of my old patients are still checking whether I'm back because they're just not happy sometimes, and or NHS wait times are just really high. What I would do in this situation is go onto Google, search for podiatrist near you, look at the reviews, see if they're HCPC registered or state registered, see if they're actually qualified podiatrists and not someone who's done a weekend course. There's a lot of cowboys out there who will come and cut your toenails, and I'm absolutely happy for them to do that. But if you're a diabetic patient, please, if there's a complications, they will not be able to handle it. They will not be able to take care of you with the guidelines. So they don't have the training to treat an infected wound or to take care of it. So please get your family member really checked out by a qualified podiatrist. If not, ask your GP to refer you on the NHS. If you're a low risk diabetic patient, you will be advised to go privately because you don't have a major risk and it's just nail care, callus, XYZ. If you're a high risk, they'll definitely take care of you. And there's a wonderful diabetic foot team, and I know them very well. So do search. There's a dire need of podiatrists in UK. I teach at the universities as well, and a lot of the focus is on diabetes because that's the national need. So I would suggest ask your grandchildren or your neighbors' kids who are at school, at college, and thinking about career options and really want to do something medical, but maybe medicine is a bit too daunting, but they really are hands-on and really are intelligent and really want to do something interesting. Ask them to go and shadow a podiatrist. Okay, or go to Royal College of Podiatry and say, oh, I'm interested in podiatry, and encourage people to get into podiatry. Add to the community. That's all I can do.
Wonderful. Chandrika has a question. Her hand is up. You need to unmute, Chandrika.
Hello.
Okay. Hi.
Yeah.
Hi there.
Just have a quick question. I go to podiatry all the time and I get lots of calluses and corns, and then they are growing more on the other side of the leg. What can I do to cure all this?
Well, if you're getting calluses and corns, the main reason why you're getting them is because you've got a lot of pressure at your feet. So it could be because of the architecture of your foot, your biomechanics of your foot, and secondly, the kind of footwear we have, the kind of jobs and kind of activities we're doing, our body weight. There's a lot of contributing factors here. Your podiatrist should be able to not only debride and get rid of the hard skin, but they can also recommend certain creams, like urea-based creams, which have 20% urea for cracked heels, and you can massage that into the area of the hard skin only. The active ingredient urea breaks down the hard skin and allows you to perhaps maintain things better yourself as well as being helped by your podiatrist. So you can simply get a foot file and just give it a light rub with the file once a week or something to keep it maintained. Otherwise, what will happen is you'll have a lot of callus. You'll wait to see the podiatrist and then it will go away and you'll have a lot of peaks. So ideally, you want it to keep a natural flow. Now, because you've got callus, a little bit is acceptable because you're getting pressure there. So it's there for protection. But when it's not maintained, you end up with a podiatrist. You might want to look at your footwear, maybe get a gait analysis. You might need some insoles to offload the pressure. And for diabetic people, I would highly recommend getting assessed. So everybody's reason, if 10 people ask me this question, I could give 10 answers if I assess them, and that's why I'm keeping an overall general answer for you. Okay.
Sure, and just I also have some weak feeling in the foot.
Weakness.
Yeah, weak feeling. You know, you feel weak from the foot, from the bottom.
Yeah. When was the last time you got a diabetic foot check?
I haven't done it yet until they call me. Just like Keith was saying, we don't get the appointments. It's very difficult now.
So ask them for a diabetic foot check. They might not get round to calling you. You can say to them, look, I've got changes. I'm a diabetic patient. I've got some changes in the sensations of my feet. I'm a little bit concerned if it's related to neuropathy. It might not be. Can I book an appointment, or can I see the practice nurse or the practice podiatrist or the diabetic foot team for an assessment? I'd like to be seen by somebody. Either refer me or see me. You can suggest these things. I wouldn't sit and wait to let them come to you because you might be on a list. So you have to. It's your responsibility, I would say, to make them aware if something's changed in your medical history.
Thank
Sure.
you.
Thank you.
Thanks, Chandrika. If nobody else has a question, I have a question on athlete's foot. This is a real problem for me as a diabetic. I get it very regularly. I get my prescription, I put it in between my feet, and then it's back again. What's the best way of trying to curtail the flourishing of athlete's foot?
So let's look at what athlete's foot is. It's an infection. Now you get three types of infection. One is bacterial infection, one is a viral infection, and the third is a fungal infection. Okay, so athlete's foot, or what we call it tinea pedis, is a fungal infection, and they're very slow and a bit stubborn and a bit sloppy to get rid of. They don't go. They're like that friend that you just can't get rid of. Okay, they hang around too much with you. Where does athlete's foot flourish? In dark, warm, concealed areas where there's a lot of moisture. Okay, that's the perfect breeding ground for any fungus. Cheese is a fungus. Yogurt, all of these things. That's where they breed. So number one, do the opposite of that. Make sure your footwear and socks are washed or replaced. Okay, now that could be a little bit pricey, but if you're getting recurrent infections, you want to replace them with something that's airy, so they're not concealed, like leather shoes or smart shoes. You want to make sure you are drying them out, because if you're wearing them for a long time and you're traveling and you're working, your feet can get quite warm and then sweaty. So you want to dry it out. You can use an antifungal talcum powder. Put that between your toes as well before you put your socks on, to make sure you're not retaining any extra moisture, and then make sure you dry it out and make sure your footwear gets a lot of light as well. I wouldn't recommend putting them outside. It's not India, unfortunately, but in case it rains. But if you have a spot generally what people do is they put them into their shoe rack and then close the door and things like that. So look at your footwear, get it cleaned, washed, or I just say replace them. I would continue to see a good podiatrist to maintain your nails as well. Sometimes those people who have fungal nail infection also have fungal skin infection, vice versa. Sometimes you can get reoccurrence because of this. Okay, and sometimes your bedding might have those fungal spores. Sometimes your partner might have fungal spores. So make sure you check their feet. But keep them dry but hydrated. So don't dry them out so you got cracks in your skin. But make sure if you've got sweaty feet or you've got tendency to have sweaty feet, or even if you've got normal feet and you're in leather shoes or smart shoes, alternate your footwear. Go to work in trainers. It's quite fashionable to go to work in a suit with trainers. Get something breathable. Let your feet breathe, and when you're home, let them breathe. Give them a wash. Give them a clean. Put some talc on there, and continue using the antifungal creams that have been prescribed. Sometimes you can get a tablet called terbinafine. If they're very stubborn, I would highly suggest you get liver and kidney blood tests before to make sure this medicine is filtered out and effectively. And if you don't have kidney or liver issues, your GP will prescribe them and give you a short course with that to completely eradicate it from your system. Usually that's worst case, but I've got this prescribed for many patients who've suffered. So these are some of the things for athlete's foot.
Excellent. Dhruv, we said half an hour. It's gone past half an hour. We're going to release you from the Diabetes Chai Chat. Thank you so much for joining us. We've been trying to get you on for a while, rather like getting an appointment to see a podiatrist. It's been quite difficult. But thank you thank you for all the support that you have given Silver Star in the past and the work that you continue to do. And come back to Leicester. Open a branch here. We need you. We'll all come and visit you very often.
Let's see. I can't thank you enough, Mr. Vaz, for all the things you do. You're a huge inspiration in the world of diabetes, and you know it, and the world knows it. And all the things you do on the Sunday on the radio shows and these Chai Chat conversations. Can't thank you enough for all the things you do. So
you're too kind.
Bring lots of podiatrists, not just me.
You're too kind. Thank you. We're going to do the rest of the news headlines from Rajiv. Okay. We've had turmeric, which is helping us. What about the last two headlines, Rajiv, before we close?
Yeah, the second headline, how sunburn could lead to sudden and unexplained rise in blood sugar levels. This is because sunburn causes physical discomfort which stresses the body. The body perceives the sun damage as an injury. As a result, it triggers inflammation and releases stress hormones such as cortisol and adrenaline. When the body is under stress, blood glucose level tend to rise, according to Diabetes UK. Next headline, lesser known eye symptom could mean you have undiagnosed diabetes. Type 2 diabetes can sometimes develop without any symptoms, although some affected individuals may observe signs of the conditions, including one that shows up in the eyes. Both the NHS and Diabetes UK have highlighted that blurry visions can be a symptom of type 2 diabetes. Other potential signs may include excessive thirst, unusual fatigue, unexplained weight loss, frequent urination, particularly at night, delayed healing of cuts or wounds, and genital itching or instance of thrush. That's all. Thank you.
Thank you very much, Rajiv. Thank you all for joining us. Don't forget, every week, every Wednesday between 1 and 5, you can get your diabetes test done at 2-1 Road. We're just giving alerts. It's just on our Silvia. You can pin any Wednesday and have your test for free. You don't have to wait. We're going to try and speak to a podiatrist about getting them to come in, maybe once a month, to do some checks on feet, and other professionals. We can't do retina scans, unfortunately. We don't have the equipment, but we're going to get other professionals in there as well to make sure that our little village that we created at the Merlin Vaz Centre is recreated at the Silver Star headquarters. In the meantime, keep eating the turmeric. and enjoy your evening. I thought it was going to be sunny. It's not sunny. Sad, but there it is. We will see you again very soon.